That congenital rubella infection is associated with an increased risk of tendinitis in the offspring. And more than 80 years ago, we learned that infections can cause insulin resistance. So if we start by focusing on type 2 diabetes, there are a number of viruses which have been associated with the disease, or proposed that they could trigger type 2 diabetes. And you are probably familiar with them all. So HIV, hepatitis C virus, influenza, and SARS-CoV-2. And I wanted to give you just a little brief update on what we know about SARS-CoV-2 and type 2 diabetes. So there has been now a few years since the pandemic was started, and we have learned quite a lot. So for instance, we know from various reported there is over 60% higher risk of type 2 diabetes development after COVID-19. And data is showing that this increased risk is persisting. Still after a year, there is an increased risk of development of type 2 diabetes. And the elevated risk is even shown in low-risk individuals. But thankfully, we've also seen that the risk of developing type 2 diabetes after SARS-CoV-2 infection is markedly attenuated by vaccination. What could be the mechanisms? Well, one thing is, of course, an unmasking of a pre-existing type 2 diabetes. So the person might have had type 2 diabetes before, and it was just diagnosed when they came in with a severe SARS-CoV-2 infection. It's also been shown that the virus can directly infect pancreatic beta cells, although it doesn't seem to happen very often in vivo. But that could be contributing to beta cell failure. There is also stress-induced hypoglycemia, inflammation, as we know, causes insulin resistance, and then of course steroids can also reduce hypoglycemia. With the other viruses, a few points which I found was interesting that I wanted to share is first with HIV. HIV is associated with increased risk of type 2 diabetes, and it's also shown that can be a risk can increase with certain HIV drugs, especially the older drugs that were used. HIV is also increasing inflammation, and additional risk factors are hepatitis C co-virus infection and lipodystrophy. With hepatitis C virus, it's important to note that those that resolve the hepatitis C virus infection continuously, they don't have increased risk of developing type 2 diabetes. But in chronic infection, the reinfection causes hepatic and peripheral insulin resistance, and risk factors are obesity and age. And the flu is often also discussed, but it's less strong evidence for an association between infection and the risk of developing type 2 diabetes. So, although I'm not a clinician, being in this session, I thought that it could be interesting anyway to summarize what can be done to reduce the risk of developing type 2 diabetes in the context of these infections. And of course, healthy lifestyle interventions are important. Vaccinations are recommended. And with HIV, it's important to screen for diabetes, and also, as already mentioned, there are certain HIV drugs that can trigger hypoglycemia by themselves, which of course then should be avoided if possible in people with high blood glucose levels. Also in hepatitis C virus, because the connection is so strong, it's advised to screen for diabetes, and thankfully, the oral directly acting antivirals actually have direct improvements of insulin resistance. So, if possible to treatment reduces risk. Now I'd like to move on to type 1 diabetes and just go back to the etiology and pathogenesis. We know that the appearance of multiple autoantibodies or antibodies directed to the insulin-producing beta cells predicts disease onset. And when we look at the pancreas, we can see that there is an inflammation around the pancreatic islets. And because of this and some other reason, we think that this is an autoimmune disease. But we who study type 1 diabetes, we think about the disease as not actually occurring at the diagnosis. It starts already here when these islet antibodies appear. And the question is, what is triggering autoimmunity? Last summer I got this email from a mother who had a daughter that had developed diabetes, and two of her close friends, or friends in the sports that she's performing, they had developed diabetes within the year. And these clusters do appear occasionally, and we don't have a good reason or good explanation to this. And of course, it brings you to think that maybe this is a communicable disease, even if it's always said it's a non-communicable disease. And then, of course, one could think about virus infections. And there are studies to show that if you look at children and we follow them from birth,